Normative is a health research platform, and we work with researchers and innovators in the life sciences to address the sex and gender data gap. We do that specifically through data collection and management to identify, assess, and address differences that we might see across sex and gender. The reason why I started Normative with my co-founder Renee is we were working in two very different fields in the academic context, and I was more in human performance and she was in actually a female-specific cancer. And despite the incredible differences in our fields in the health sector, we ran into the same problem, which was the dearth of data within our disciplines that accounted for the impacts of physiology, female-specific physiology, on our given fields. There were a few ways that engaging with UCeed has helped. I mean, the first one, obviously, is that getting UCeed on board at the early stage was one of our first institutional investments. And so even today, as we are going into our seed round, being able to say, at this life stage, or at this life sciences pre-seed stage, we managed to find institutional investment. That's not entirely common. It's often angels at that point. So, and then the level of due diligence on the technical side has been something when we've been able to pass on to other investors and unlock other funding. So that's really meaningful. We removed a lot of the logistical barriers for actually accounting for, right? So we used to not include, then we include, then we didn't account, and now we're trying to move it into accounting. But accounting for female bodies has traditionally been very burdensome through both a logistical, financial, and social means. And so that for us has been a major mover in terms of reducing costs, reducing participant burden, and increasing the scale of the studies so that when you're finished your study, you're able to move something through to a more generalizable state and get innovations to market faster to improve health outcomes.